We're here today to discuss a little bit about using surface-guided radiation therapy to make tattoos a thing of the past. We're going to discuss a little bit about what tattoos have traditionally been used for, the psychological effects that radiation tattoos might have on our patients. We're going to study Align-RT and how it can be used to replace radiation tattoos, and I'll show you a couple of case studies and some of our initial findings from our clinic. So tattoos, when I started out my initial research on how did tattoos actually involve in radiation therapy, I found little to no evidence of it at all. All I could see was that we use radiation tattoos, and I have no idea when they started. So if anyone has some good articles on when and why we chose tattoos as our marking system, that'd be great. I turned to some of my therapists that have 25 plus years of radiation therapy experience to see when and how they felt tattoos evolved into their clinic and into their practice. A few of them had told me that it came about after the silver nitrate phase, and when we learned that silver nitrate just was not good practice for our patients. And then I had a few tell me, well, that's just the way it's always been done. For anybody who knows me, you can ask Matt, actually, he knows me really well. Anybody who knows me, that statement does not sit well with me at all. If somebody says, that's just the way it's been done, I'm gonna go out and find out why and where and what is there to replace it? Why are we just continuing with this, especially if we don't have any research backing it up? So we had to do a little further research, and from my further research, I still discovered nothing. Tattoos have just become our gold standard. Tattoos originally started for centuries ago as an art form. They were a rite of passage in some societies and a mark of tradition and culture in others. However, in many cultures, then and now, tattoos are still a taboo. Tattoos are generally in our departments administered by the radiation therapist using a needle. And in particular, in our clinic, we use a 22 gauge needle, we use a pipette with Indian ink in it, and we fill the pipette for every single, an individual pipette for each patient to create a sterile process. This is what sometimes happens when you fill in those pipettes. They get a little messy. Traditionally, though, going back to where radiation tattoos in radiation therapy have been used as a mark of isocenter, a roadmap to say for us in direction to follow to where we need to get to for treatment. As you can see from the picture on the top left-hand side there, that's kind of the Thomas Guide edition of roadmaps, I'd have to say. So, medically, it's been justified that radiation tattoos traditionally have been given for precision and accuracy. Since patients generally receive multiple fractions of treatment in their there's a long-term need for consistency of this setup. Tattoos also provide our radiation oncology team with information about previous treatments to help avoid re-irradiation to these areas. With the advance of computer technologies, we kind of no longer need that previous irradiation stuff. We can get it from the clinic directly. So do tattoos really still serve a purpose for that matter? Therapists, as I mentioned, have been using tattoos kind of for alignment purposes. We use them to get the lasers on, but really, is it still necessary? Although there may be just medical justifications, patients still don't agree with getting tattoos. In a clinical review titled The Psychosocial Impacts of Radiation Tattooing for Breast Cancer Patients by Barbara Clow and Janet Allen, they stated, while healthcare providers stress the need for tattoos to ensure accuracy as a permanent record for radiation exposure, a growing body of research and anecdotal evidence points towards an interest moving towards alternative methods and also permanent removal of these tattoos in radiation therapy. It is well established that radiation treatment can cause a psychological impact, a negative impact on our patients. The effect to which radiation tattoos plays a part in that is still yet to be studied. And as technology progresses in our field of expertise, more and more measures are taken to move forward with these technologies. I always wonder, though, why haven't we done that with tattoos? Why are we still giving our patients tattoos if we're moving forward with our technology? As more patients begin to speak out about their experiences with radiation tattoos and the search for their removal of these tattoos, I feel like that we will start making progress in this area. There's two brilliant women who motivated and patient advocates and caregivers, Robin Walker and Mena Creed, who set out earlier this year to do a kind of research study, also a survey, to get a more in-depth perspective on the psychological effects of radiation tattoos on patients. In late February, Robin and Mena attended the Young Survival Coalition conference, where they were given the opportunity to survey a small cohort of patients. They initially received 78 surveys in response and have now come up to close to 130. For these surveys, there was questions on there as far as what part of the country patients received their treatment in, where they had their tattoos, how many tattoos they received for treatment, were they given any alternative options, and then the golden nuggets. If there was an option using a different type of technology, would they have opted out of getting tattoos? Also, how far would they go for this technology? 52% of those who responded to the survey had received tattoos alone. 25% stated that they had received temporary marks alone. 23% had received both temporary and permanent marks. However, none responded that they didn't receive any marks at all. Of those who responded that they were given temporary marks, they later in the comments section had put comments such as the temporary marks would cause stress on them. The constant worry of having to keep these marks on them and worrying that if they had lost these marks, what would be the accuracy for their treatment. These are just a few of the comments that came back from the survey. Having been part of CT simulation for so many years, seeing these comments from the YSC survey were not surprising to me at all. If anything, they were somewhat reassuring to know that it's not just patients in my clinic that had these concerns, and not just patients in my clinic that were upset with the fact that they had to receive tattoos. I personally have received several phone calls from patients after they have completed their course of radiation treatment, asking for referrals to a local laser removal place. And if anybody knows costs in San Diego, it's not cheap to get done. With that said, it's important to also remember that there are a small cohort of patients that find these tattoos to be a bond and a kind of support group from them. They look to these tattoos as a talking point in our lobbies. They look to these tattoos as a starting point to tell their story. And at the completion of their journey, these tattoos are their medal to say that they've completed this journey. But what also makes me wonder is, this small cohort of patients, are they feeling this way because they don't know that there's another option out there? That they might fear that if they don't receive radiation tattoos, that they might not get the same accuracy of treatment? Or as one patient had commented, I just accepted it as part of my journey. We shouldn't just accept anything as part of our cancer journey. So as I mentioned before, when somebody provides me with a statement that that's just the way it's always been done, my brain starts to go to the why, and how can I change that statement? How can I be the person that changes this is just the way it's been done? So in June of last year, we commissioned and began using Align RT for our SRS brain patients in our clinic. Having previous extensive use with Align RT, having worked in our main campus, I thought of, well, okay, I've already done this. What else can we do? I began to talk with our physicians, and we started to move towards using Align RT for secondary monitoring of our DIBH patients. Now, I know this has been done in many clinics, and that's not something new. So we quickly realized that this is great. Align RT is our second set of eyes, and we felt more confident when doing our DIBH patients. As we became more comfortable with the ease of use and increased accuracy of the setup, we began to rely less and less on our tattoos. Myself and the physicians soon realized that there were therapists breezing past the tattoos. I would go down to watch my therapist set up breast patients to see how things were going, and they wouldn't even spend 2 seconds using the tattoos. They'd kind of fiddle around, and then they'd move right to Align RT. So I brought to their attention that they were not using the tattoos. So was it really necessary? We quickly realized that no, it wasn't necessary. We became very comfortable with the system, and so we decided to progress. If our physicians weren't quite ready to jump into the same pool that we were, so we took it a little slow. We began using tegaderms and temporary marks for our breast patients. And we also started to add into there our extremity and our lung patients. It worked out really well. We would go straight to the tegaderms for alignment until we had this one really long month of heat waves in San Diego. And slowly, patients would come in and they wouldn't have their marks on them, or they would be completely bundled up to the point of where they're just distorted and you can't use them anyways. So we were kind of in some ways forced to go completely tattooless. We ripped the tegaderms off and we went tattooless. We, in some ways, the patients were given more information, of course, about Align RT before we just jumped into it. We wanted to make sure that they were comfortable in knowing that they were receiving an accurate treatment. In some ways, this actually gave patients a security blanket. I have been mentioned several times by patients where they don't see or feel anything during treatment. So how do they know that something's actually happening? How do they know that we're really watching them? For those patients, this was a security blanket because that red light shining down on them meant something was happening. Somebody's watching them, and we're going to stop if things don't look right. We decided to start doing some studies. So on January 8th, which is when we started with our first breast tattooless patient, we started marking down the start time and the finish times for all of our patients. Since then, we've treated approximately 30 new start patients, which is approximately somewhere like 700 fractions of treatment. Between our daily setups included the patient setup, the treatment, and then also weekly port films. Patients with tattoos averaged about 16 minutes. Patients without tattoos averaged 17 minutes. Oof. 1 minute. That could be attributed to some outliers, guys. Patients could still be treated with exact same accuracy, and not to mention, the anxiousness part. It made them a little less anxious knowing that somebody's watching, that there's a second set of eyes out there constantly during treatment. But the proof is always in the pudding, right? So it's really important to see what the images look like. So I'll give you this is a day one. This is one of our first patients that was treated. And this is after we set her up with Align RT. She was a large pendulous breast patient, so we had to use a rolled gauze underneath to kind of separate the skin fold. And as you can see from the image, her setup was pretty good. We found that from our study, setups with tattoos alone gave us a residual error. This is looking at it in offline review. They gave a 4.2 millimeter for the chest wall patients and 6.4 millimeters with the soft tissue. Patients without tattoos and just using SGRT system alone had a residual error after setup of 0.7 millimeters and 1.3 millimeters for the soft tissue. Our data revealed upon initial setups that tattoos alone resulted in less or equal amount of time for setup. We then also we did a study of our extremity patients. When we then moved, as you can see, to the extremities, and then the residual error from initial align RT to KV-KV matching was pretty reasonable, as you can see from the chart below. There are a few outliers, and those would be the patient wasn't set up longitudinally correctly on the table because there's no indexing with our VAC locks. Most days, our shifts on this patient were under 5 millimeters. And the day one, these are images from his day one setup. And this took us approximately 15 minutes from start to finish. That includes getting the patient on the table as well as using the line RT and then taking our KV-KVs and our MV ports. This patient we felt really bad for because he would drive 2.5 hours to get to treatment, to then come to our clinic and be treated in 15 minutes. We also, so this is what it looked like when we were using a line RT for this patient, for the extremity. We then moved on to treat a clavicular head patient as well. She had a very tiny clavicular lesion that the physician did not feel comfortable with tattooing because she's a very young patient. On day one, her images looked really good after setup, and her average setup time was 15 minutes as well. As you can see from the graph, her daily imaging and residual setup error was less than or equal to 3 millimeters daily. So just in our clinic alone, we found the initial patient reaction to be that they were thrilled. Adding SGRT system in our department brought benefits to us as well as to our patients. Being able to move away from tattooing patients was a huge time saving in CT simulation as well. We no longer had to sit there and explain to them why we were giving them tattoos and then wait a few minutes for it to all sink in, and then the tears. We also didn't have to worry about the spills and the tears and the pricking ourselves with the tattoo needle. Or the worst case scenario is being able to find a good place to tattoo. So all those worries went away. But the biggest and most important thing that came out of this study was that our patients could not be more happy. Living in a place like San Diego, where aesthetics are a big deal to our patients, having to get those tattoos was quite the burden on them. I recently have had several patients, actually 2 in general that I can think of right now, that began to cry when I told them that they would not be receiving radiation tattoos. They had previously gone on websites and done their research to see that tattoos were part of the scheme and part of the reason, part of the whole game plan. So when they began to cry on the table, I stopped and asked, and I said, well, are you sad that you're not getting them? Or are you happy that you're not getting them? And they all said that they were happy and that these were emotional. They were emotional because they wouldn't have to deal with this forever. The YFC survey that I mentioned before uncovered very similar results to what I have mentioned, as well as to what Clow and Allen mentioned in their article. 77% of those who responded to the survey stated that they would have chosen SGRT to avoid tattoos or marks if they had the option. That same 77% also responded that they would drive an average of 49 miles in one direction in order to be treated in a clinic that offered SGRT. That's a big take-home. Based on the preliminary research, patient forums, and surveys such as the YFC survey, I think that it is safe to say that patients, if given the option, would opt out of receiving medical tattoos for radiation therapy. The psychological effects of having radiation treatments is well studied and known to cause stress and negative impact on patients' lives. Receiving tattoos as a long-lasting memory of a stressful time is hopefully becoming a thing of the past. SGRT is helping to improve patients' psychological well-being during radiation therapy. Let's help to make the mess a past.
Questions?
Oh, I'm coming.
Are you guys using any type of skin marks in conjunction with your
Align RT system?
No, we're not using any skin marks at all.
No
So,
Tyderms, nothing?
no, for our breast patients, we will use a nipple line reference or a scar reference for the chest wall patients. And then for extremities, we kind of generally bring them into the longitudinal that's captured on day one and use that as a daily reference. Day one can be a little tricky with the extremities not knowing, but we do mark the vac locks so that we know kind of a beginning position. For our lung patients, it's the same.
Okay, thank you.
Hi, I have a question over here. We are also a tattoo-less facility. However, we still use taxiderms most of the time to line up our patients. With our SGRT, we have had some instances where our cameras have been down and we are unable to use our SGRT. What do you guys do in that instance if you are taxidermless and tattoo-less? Are you imaging every single patient? And if you are, to ensure accuracy, how do you compensate for all of that time that now you have to take films and images and all of that kind of stuff?
So with our breast patients, having the indexing, so everything is kind of indexed we use a breastboard. So our breastboards are indexed, and then you have the nipple line for your longitudinal. We still have a depth that's given to us, and so as long as it's captured on day one on the 4DTC, your parameters, you can use those as a general reference. So we'll start there, and then we would start by taking a KV-KV pair to make sure that we're on. With our extremities and our lung patients, we're daily imaging them anyways. We're still doing a KV-KV pair. And then we do a verification film every 5 treatments if they happen to have MLC leaves in there.
Can I have a show of hands of folks in the room that are not using tattoos?
Oh, that's awesome.
Very good.
I had a question. Do you have any problems with any patients who have gone through radiation before and they're used to having those marks and now you're bringing them back and telling them we're not going to have marks? Do they have that kind of non-confidence in it?
I actually have had patients recently who have gone through that, who are, they're dealing with metastatic disease. And so the easiest way for us to put it to them is to say, we're trying to make it less complicated for us for your daily setup. As you could see from some of those patients, the very first image with the roadmap, there was one patient there that I had showed a picture of, and she had, when I counted, 16 tattoos because she's just had so many metastatic reoccurrences. And so I think for her, hearing that she wouldn't have to get tattoos because we were trying to make it less complicated and less confusing for us, she was actually very comfortable with it.
Hi, congratulations on being tattoo-less. We are also tattoo-less and markerless. In answer to someone's question, we actually record ISO placements on all our patients. So if the system was to go down, we just can remark them up with the Chinograph pen. And we've always done that, and so if someone wants to know where someone's treated, we haven't tattooed a breast patient for 20 years or any other patient for 6, and we've never found a problem with it.
Awesome.
Hey, so great talk. I just wanted to make a couple of comments really. Firstly, like the slide from around the patient feedback, I thought that was super powerful. And one of the reasons that we should always be asking our patients, we've got all this technology and sometimes we will use it for certain bits of treatment, but we've got to keep the patient right in the center of everything we do, and that's a great bit of work you've done there. And then secondly, I wanted to sort of say as well that we've been tattoo-less for a while, and one of the comments that I get a lot when I go out and talk about tattoo-less is from consultants that are very worried about, what if my patient comes back for treatment in 3 years and there's no marks, what do we do? I'm sure you've had that a lot as well.
Yes.
And I think like getting the message out that, I'm sure there's no consultant in the room here that would replan a patient's treatment from a tattoo mark when they've probably lost a lot of weight or gained weight. It will always come from the TPS. So, I guess that messaging needs to be pretty strong as well to everybody.
Yeah, our dosimetrist actually was very hesitant at first to go tattoo-less as well because she felt the same way that, well, what are we going to do? What do we do when these patients come back? we do have this advanced technology, and we do have the ability to knowledge share with all of our other clinics to give them the information.
Excellent. Perfect. Thank you.
Thank you.